that we should work towards an integral service. You can also call it holistic approach, an integral service model for cure and care. Not just the cure, but also the care. And that in each expertise center, if you're really an expertise center, you should have a person or persons to take care of care. And I have seen that myself. I had the privilege to see that in some of the expertise centers, for example in France, they are quite advanced in all this. Having special workshops and so on for patients to be informed, but also to give them some practical advice how to live with their physical handicaps and so on. The Hôpital de Bicêtre, David Adams, is one of the examples. And there are more than that. But you should have a person really, and that's what the point we're trying to achieve now also in the Netherlands, in my own country, is that you have, of course, the doctor and the doctors in charge of cure, and you have other persons or the other person, and they take care of care. That's why you can show the last slide. Is there another slide, or are we out of slides? Yeah, okay, that we should have a person to take care of care. That is important, not just the very good doctor, but also the other person who takes care of that. So that the person who comes to the expertise center, to the reference center, when in whatever country, and goes there, and that there is a person also who can ask the question, how are you? Tell me, how are you? What are your problems? Can you cope with the situation? And that person has time to listen and to give some direction and some guidance and some advice. At least that's what we think also now at the Alliance. Thank you.
Tatiana, do you want to say a few words?
Good morning, ladies and gentlemen. My name is Tatiana Weiss. I'm an ATTR patient and member of the FAP e.V. in Münster. Filling the gap between cure and care is one of the hardest things when it comes to this rare disease, where even the diagnosis could take months and years for the patients. I'm aware that we in Germany are in a very good position when it comes to healthcare. We have 8 expert centers for amyloidosis in German-wide, and I would like to talk in some few words about my experience in Münster, where I have been for 15 years now. In Münster, there is a special ATTR consultation, and as soon as a patient is diagnosed, the patient is seen there once a year with multidisciplinary approach. As soon as there are the first symptoms, the patient will go there twice a year, and then there will be a therapy offered with all types of trials that are available on the market at the moment. There are more to come in the future. In addition, in Münster, there is offered nutrition care by Dr. Hüsing Kabat, whose presentation we heard yesterday. We have this brochure now available. It will be offered genetic counseling, physiosomatics, and some surveys, for example, the one of Dr. Fabian Bolte that was presented yesterday in the Patients Forum. In addition to this cure, we founded the FAP e.V. in 2016 with 40 members of patients and family at the moment. We are member of the AXE and Eurodis and the Alliance. We are the contact for persons. We have an internet contents and an office room with 2 employees at the moment where patients can ask all kinds of questions, and we would be helpful to help them with that. Once a year, we have an amyloidose day in Germany. The next is taking place in Berlin in November. We have member meetings once a year where all kinds of questions are trying to be solved. Topics like physiotherapy, helping gadgets, questions all around the family, discussions. We have one member of our organization that offered legal advice for patients. So we try to help patients to cope with their disease and help them to make their daily life a little bit easier and to have a better quality. Thank you.
So Conrad introduced the holistic approach, what we can do on top of the treatment for the patient. And I would like to share with you one example, which was developed in Paris, in Kremlin-Bicêtre Reference Center, which is bringing an addition to the treatment and for the quality of life of the patient. So the team who did this booklet is here, Agnès Morier and Margot Cornec, and they coordinated an action of different experts. So they produce this booklet, which is existing currently in French, in English, and soon in Portuguese. And this is a great help for the patient. The best approach is to be followed by a physiotherapist, but with this booklet, you can do some exercise at home to stimulate your nerves, some massage which can help to reduce the pain, and also exercise to keep the muscle as good as possible. So this is very interesting because that's very practical, and we need to build some tool to add to this kind of one, to offer to the patient the best support. And the idea through the Alliance is to develop those tools and have it available in a different language, really to support all the patient organization. Thank you.
Yeah, let's have the questions now, because we look at the time also. How much time we have now, Julian, for? 20 minutes. We have 20 minutes for all sorts of questions and ideas and proposals. Please go ahead.
Very short question. Jean-Christophe, this booklet, is it available here?
Actually, we have it online, so we can share the link for at least the English version.
Okay, that's on the website of the French, not the Alliance. Which website?
Yeah, actually, we will post it on the Alliance website very soon.
Okay, will be on the Alliance website. You know all the Alliance website? Otherwise, we will project the Alliance website. Okay. Well, further questions. Are you? It's all clear. We still have some time for some of your proposals, ideas. There seems to be broad agreement that we should go for a more integrated approach. I don't know now if Immaculada Montades is here in the room, because she's a social worker, and it's interesting because she worked together with Maria Teresa Coelho in Portugal, and she did a very interesting survey also on what patients' needs are, apart from the good and the excellent cure, of course, we all want. So it's a nice collaboration between social scientists and a university, social scientists, and let's say a medical center. So there's growing attention for this, you can say, and thanks to all these surveys, because the survey was mentioned in the UK, but there are surveys also which have been done in other countries, in Spain and in France, about, well, how we can accompany the patients and what are the specific problems of the patients and what can we do about it. And that is something I think that's at the same time, it's a lot of work also for the patient organizations themselves to be well informed about what the patients actually need and how we can assist them and to have a clear perception of that and then take action on that.
So I'm sure you have ideas regarding what the patient needs. We try to progress on some axes, but very limited. So please tell us, what do you think is important for us to work on? Any proposal?
I have a question to Conrad. I was not in the group of patients yesterday to listen about the access of the disease-modifying therapy. We know that we have 4 different treatments, and what is the real situation now on the access of the therapies, on tafamidis, inotersen, patisiran, in the different countries? Can you explain exactly where we are? And the idea is what we can all together, as we are here today, and we were 2 years before in Paris, do to increase the pressure to have access in more and more countries in the future. We can sign letters all together and for the government and ministry, but it was a fight and war during the last 30 years to develop this treatment. If it is not delivered to the patient, we are not successful. So if we can do more, we can do it.
Yeah. The question is easier than the answer. I would say. We have, I don't think we have them all right available, the slides which show the access in different countries. Huh? You can perhaps, I think, Jean-Christophe,
I don't know if we have time enough to show and...
But you can give, already answer to part of the question.
Yeah, I need to give a comment. I think we need to have the slide.
Yeah, we need to have the slides. But I think it is, of course, already partly in the direct, which goes in the direction a little bit already of an action and an answer, is that that we see if there are specific countries where there is no access to medicine, that we as an alliance say, okay, and we send a letter to the representatives of that country and say, yes, we know that that medicine is available in country A, B, C, D, E, and we know it's not available in your country. Just as a support to them, so that they subsequently can go to the ministry and to the health authorities and say, hey, look, that's what we have seen in Berlin, and we want some sort of an explanation why it is not here. I think that is a sort of a follow-up, what we should do in cooperation with the patient working groups and the organizations which we are working with, and give them very clearly that information and that material with which they can go to the authorities. But I think this is some interesting slides if you can see. Yeah. I think, is it, yeah, Isabel, huh? Yes, please.
I see you have the slide up, but I wanted to just add that at the Amyloidosis Research Consortium, one of the questions that was coming from payers and different HTA bodies was, what is the value of the NIST score? What does it mean to patients? There wasn't a well-defined burden of disease and understanding of the patient need. So we did a very comprehensive study with our group in the UK, And the data that's been produced from that has been available and was really supportive. And Julian, you can probably talk about this for the NICE approval. It's also been instrumental in getting these drugs approved and reimbursed in the US. We've worked with the Brazilian group to translate the data into Portuguese, and they've used it there, and Fabio can speak to this. And this data is available as a data package for any patient organization. We also will have developed in the next, I think it's being released in September, is a comprehensive toolkit to help patients get up to speed and trained on how to use the data and how to engage with your HTA bodies and when, because it's very important that you do so in the right order and process and develop the relationship to then provide the evidence you need. But I think this is something that that's really useful for all organizations to use, particularly those that have either it's not available in their country or there are subsets of patients that are still struggling to get access.
Well, thank you. Forward to all this. It's going. Yeah. Please go ahead.
Buenos días. Bueno, nuestra petición desde Latinoamérica y desde América del Sur es poder llevarnos una carta firmada por todos los miembros de la Alianza para que los gobiernos se pongan a trabajar con los laboratorios y puedan, por ejemplo, bajar los precios de los medicamentos, porque en Argentina, desde enero, que los gobiernos no están comprando los medicamentos disponibles para los pacientes y, bueno, creemos que es una necesidad y una oportunidad de estar presentes aquí y poder llevar esta carta y hacer presión para los gobiernos porque realmente nuestros pacientes están perdiendo tiempo de vida. Acá en Colombia también agregan toda Latinoamérica y América Central.
Okay. We get the translation
Yes,
now.
I'm going to translate into English. It would be very good for us from Latin America and South America to leave the Congress with a letter signed by all the members of the Alliance, which asks the governments in Latin America to work together with the laboratories in order to try to negotiate prices. Because in Argentina, for example, since January, the government is not buying available drugs anymore, so we are losing time. And the same is also true in other countries, in Colombia, for example. So it would be very important for us, as we are here at the Congress, to have a letter signed in order to exert pressure on the governments to act.
Okay. We can, yeah. Teresa? Oh, yeah, there's three. Ah, good, Teresa. Yeah.
I'm very sad to see that Portugal is not listed, and it means that the Portuguese Association is not present as such in this meeting, and I'm very sorry about that, but it's something that it's their decision. I don't agree, but it is what it is. Anyway, in Portugal, our situation is more or less similar to Spain. We just have access to tafamidis for polyneuropathy, but it's even worse than Spain because we have early access programs approved by the regulatory authorities, but they are blocked at the hospital, at least at my hospital. That is the largest reference center in the country and probably everywhere. So we have nowadays a very critical situation with patients that are waiting for more than 1 year for the new drugs, and they do need them desperately.
Okay. Let's go here. Please go ahead.
Maybe an answer to the demand came from Argentina. So I think this is precisely one of our role as the Alliance to support the countries to have access to the medicine. So yes, we will do that. Maybe not tomorrow, but we will do that very soon.
After this first proposal, I have a second one. We have see a table. Maybe we can have a map with the different access in different countries. We have probably the email of all our participants in this country, in this meeting. I propose every 3 months to update by newsletter the new access of new country to new drugs, and to, I hope, every 3 months it will be changed, and to have a new map and situation in 2 years in London. So we have to, I think it's very important that we'll be prove and show that we'll have very active and influent in this situation.
Well, we have this task force under the leadership of Fabio. And normally when it is met task forces, they are there for a limited time, and when they have completed the task, then the task force is dissolved. But we have said already yesterday that it was a task force with an ongoing task. So I think, Fabio, I think this task force will continue. And I think when it comes to this proposal of the updating, and then with the results shown on the Alliance website, so that you can see and follow how this develops. One thing also which has Fabio done, but there the information is not yet complete for reasons which you will understand, that's about the prices. Fabio has collected some information on different prices, but this is a highly touchy issue, and even very difficult to know the exact price, because often there's an agreement that a discount is being given, and you do not know the discount. So it's tricky. But anyhow, there are good reasons, and I think there is one of the points which came out of our meeting yesterday, is that when many countries work together so nicely at the level of the European Medicine Agency, when it comes to assess the effectiveness and the safety of medicines, and give admission and allow certain trials to be done, things like that. Why is there not much more coordination and cooperation when it comes to the prices? Not in my country, but I guess it is not much different in other countries. The minister, now more and more, they become aware of the high prices for the rare medicines, and they do not longer accept it. There are questions coming up in the parliament and things like that. And there we should follow all this closely and monitor this closely, because we should make sure that we have access to the medicines which can help us.
Maybe we should come back to a previous point where we are asking for proposal, idea of element to progress. So there was a representative of Austria who want to say something.
Yeah, I mean, I'm no expert at all, so I don't know how it actually works. But what my proposal would be that we look at it on different levels. So as for the European countries and the members of the European Union, there should be something like a common policy on certain things like medication. And I don't know, maybe you have more experience with that, but I would say this would be a promising approach that you, can you put the slide back we had before? Okay, doesn't work. When you look at this slide, you see that there are only a few European countries in it in total. So you have France, you have Spain and Sweden, and the UK. UK, unfortunately, We cannot say a lot at the moment. Italy. And what you can see is that there is a big difference on inotersen and patisiran. In some countries it's available, in some countries it's not available. So this doesn't make sense from a European point of view. And why is that the case? I have no idea, but I think that would be a promising approach. Also for argumentation. Germany is missing, Austria is missing. You will get our data, so we can fill in that. But on this level, there should be a special task force working. That's my guess. For the rest, I see the same. I see the same way as you have just proposed, that we send letters to the government of or the health organization of governments in South America and whatever, and ask them for support. But in the European Union, we have other tools in order to, stronger tools, more like hammers than nails.
To answer, I think we have a very good EU model. So we have to be sure that all European countries have access to the new therapies. And we have to focus our efforts now. And after that, we will use this model to the other part of the world, I think. So the other point I want, because these new therapies for new rare disease are very expensive, we know. So the Health Ministry in France, for example, the condition to deliver these new therapies for the patient, there is a price to reimburse, but the condition, the expert centers must see regularly the patient every 6 or 12 months and to report some efficacy on the neurological point of view or cardiac point of view, to be sure that the drug is active. And this is a condition to have in the future the drugs reimbursed regularly and not after 1 or 2 years stop reimbursement. It's even in the case in France. So I think this is a deal between the patient, the expert centers. Okay, we give you the expensive drug, but you have to give us some argument on the efficacy of the drug, and this is very important on the efficacy and safety. So this is the deal, but I think it's quite not very difficult. We develop a plan in France to do that, and I think it will be the case for every country.
Also, in terms of economy of scales, when we look at the whole European Union, then we are not arguing also with the pharmaceutical companies about 30 people and 50 people. We are talking about thousands. And this will change also their view on the pricing, I guess. Right?
Yeah, as Professor Adam said, it's already standardized at the European Medical Agency, the safety and the efficiency of the medicine, but in each country, this is separate negotiation. This is part of the task force which did not started yet, and the one introduced yesterday by Giovanni, the advocacy task force. And there are some organizations like Aurordis which may help us to progress on this side. And we are member of this association, so that will be a big workshop to launch.
I'll just make a comment on that. There are two different things. One is deciding if a drug is safe and effective, that gets approved at the European level. The other one is, should the health system buy this drug at the price that it is? Is it cost effective? A couple of comments on this. The countries that are there are the ones that bothered to reply to Fabio's emails. So if the country's not there, it's because they didn't reply. And this survey was done in March, so it's already fallen behind. Because, for example, in the UK, we have patisiran and inotersen approved. The other problem is that it doesn't just come to country level. For example, in the UK, England approved it before Scotland. So you could have that. There was a period where it was available in England, but not in Scotland. In Spain, there are 17 autonomic communities, and each one of them decides to buy it or not. So it depends on where you live, you have it. In Switzerland, at the moment, if you live in Lausanne, you get it. If you live in Zurich, you don't. So it just depends on who's going to pay. So the important thing is that the patients are there lobbying and explaining what the burden of the disease is, because that doesn't get captured very well. And this is where what Isabel mentioned, the ARC survey, was very helpful to us in the UK. We went through the NICE process, which is the regulator in the UK, and having that information and being able to represent the patient views was very helpful to get it approved. If you don't have patients pushing for it and putting the evidence and the point of view of the patient, you are less likely to have it approved in your country.
Thank you, Carlos. So, yeah, there's before a last question.
Just a comment from Sweden.
I'm looking forward to get a cup of coffee, I believe. So, if it's the last question.
Just comment from Sweden. This slide is not correct. Patisiran is not approved in Sweden outside clinical trials. And I want to support the suggestion from Austria about negotiating on a higher level, not in a local area in Sweden where we don't have the money to provide treatment. That's all.
Yeah, what we are trying also is, and that's also part of the task force, is that you not only have information on where the medicine is available and where, in which country not, but that you also have more information about where are the clinical trials, where are the, and where are also trials or easy access or early access programs going on. So that's the kind of information you can use, I think, as patient organizations in your advocacy work. Like Carlos has said, also when you do surveys on the burden of the disease, again, it's not only to get a good perception of what patients need, but you can use it also in your advocacy work. Thanks for all your very helpful suggestions and ideas. Well, there's work to be done, and, and we do it with pleasure, and we count on your cooperation. Thank you so much for that.